Hello, everyone. Thanks for joining. We're just going to give a moment for everyone to connect to their audio. Good morning, everyone. Thanks for joining. We'll start in just one moment. Hello, everyone, and welcome to our ISPCAN monthly webinar. My name is Jane Estes, and I'm the Knowledge and Content Development Manager for ISPCAN. ISPCAN's monthly international webinars are always free of charge and cover diverse topics which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help our members and partners in the ISPCAN community gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes of children globally. Because we believe that you should have access to all the information and resources available to support you in your work, we encourage you to visit our ISPCAN Knowledge Hub. The ISPCAN Knowledge Hub is an open-access, centralized library containing ISPCAN and impactful partner resources. This user-friendly hub features ISPCAN webinars, journal clubs, masterclasses, monthly article insights, data-driven global reports, and shared partner and downloadable resources. If you have an open access resource that you would like us to help disseminate in our ISPCAN Knowledge Hub, please email it to me at partnerships@ispcan.org. We are so glad that you are here with us today, and we wanted to share some tips for making the most of today's session. Please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We will use your questions to begin the Q&A session immediately at the conclusion of the presentation. To enhance your experience, you may enable closed captioning from your Zoom control bar by choosing captions. And please take a moment to introduce yourself to other attendees, our moderators, and our featured presenter in the chat box. Let us know where you're joining from and your organization and discipline. From our registration list, we have representation in the audience today from over 90 countries, 40 organizations, and over 20 disciplines. And for joining us today, a recording of this session, the panel discussion, presentation slides, and link to the featured resources shared will be sent to you after the webinar. Today, we're going to introduce you to the Strengths and Stressor Assessment Tool. Safety and risk assessments are critical to our understanding of what factors contribute to the immediate safety needs of children and the risk of future maltreatment. Child maltreatment often occurs within a complex and interacting set of factors at the individual, parental, familial, and societal levels. Many child protective risk and safety assessment instruments are used to identify immediate safety threats and the likelihood of recurrence of maltreatment in the future. The Strengths and Stressor Assessment is an ecologically-based assessment that measures strengths and stressors on the following domains: environment, parental capabilities, social support, family interactions, family safety, and child well-being. With this in mind, our key learning objectives for today's session are to give you an overview of the Strengths and Stressor Assessment instrument with examples on how it has been used in practice among different stakeholders. We'll provide insights into how the assessment can be used to tailor interventions to the family's needs while also taking into consideration their strengths. Today, you'll have access to the Strengths and Stressor Assessment instrument, the Service Planning Manual, the emerging research and knowledge base, the different stakeholder perspectives, and recommendations on how the tool can be used in different practice settings. And now I'm thrilled to introduce you to our presenter, Dr. Scotty J. Cash, Associate Professor of Social Work at The Ohio State University and member of the ISPCAN Distinguished Advisory Council. Dr. Cash's expertise has focused on assessment and targeted service delivery for at-risk children and families. Scotty served as the principal investigator on the evaluation of the state of Ohio's comprehensive assessment and planning model. The project evaluated the measurement of safety and risk for children and families involved in the child welfare system. A primary aim of this research was to identify the relationship between the family's identified needs, services received, and outcomes. Dr. Cash has continued her research on matching services to needs in her most recent work on adolescent mental health and social media. Scotty served as a research partner to the Young and Well Center in Australia, which is a worldwide leader in using technology to engage young people around mental health and positive well-being. We encourage you to access Dr. Cash's full bio at the link on the screen. And now it's again my honor to turn it over to Scotty Cash.
Hi, everyone. Hi, everyone. I'm Scotty Cash. As Jane mentioned, I'm an associate professor in the College of Social Work at The Ohio State University. I'm going to go ahead and share my screen. Okay. So before I begin, I want to acknowledge ISPCAN and their incredible group of leaders, and also the members who I've made connections with both at conferences and then throughout the years, and have established some pretty meaningful relationships with my colleagues. Also want to acknowledge Dr. Marianne Berry. She is the creator of the Strengths and Stressors Assessment, and then Boys Town National Research Institute, and the families and caseworkers there. They are the ones who created the service planning manual. All of the materials will be available to you after the webinar. So Jane mentioned the learning objectives, and so I'm not going to spend a whole lot of time on these, but if you want to go back afterwards and assess whether or not we met them, then that's my plug for doing research and evaluation. So the material I'm presenting today is talking about why is assessment important in child maltreatment and child protective services. And actually, this can also be applied to working with families in general. So you don't need to be a part of a child welfare system in order to use the assessment. It really does extend to families in need and not just child protection. The types of assessments that I'm going to briefly go over are the safety assessment and the risk assessment. But then I'm going to spend the majority of the time talking about the strengths and stressors, and also about how do you logically link the assessment with services. And the model that I'm presenting, as I mentioned a minute ago, is the Boys Town model. So what's at risk? What we know is that children that grow up in an environment where there's toxic stress and where there's abuse and neglect, and even issues just within the general family, that can have an impact on their lifelong outcomes, and that it can also be translated to, I'm a social work professor, so you have to forgive me if I don't know all the ins and outs of genetics, but we know that there's epigenetic transmission of stress over time, which that was key for me when I first learned about toxic stress. And I've taken this is from the Center on the Developing Child at Harvard, is that we sometimes have looked at families and said what's wrong with them. And what that foundation of epigenetics is that there has been a transmission of stress over time. And so it really moved from blaming families to understanding the environment in which they exist, and then the history and how that's affected them. So the importance of assessment, what I believe is really important is that it helps us to understand where we start, and then also where do we want to go. So in research and evaluation terms, it's what goes on at intake, and then also what we're looking to see towards the end. Now, how are you going to get there? that's where we can make the linkage between services and what the family's needs are. For those of you who are in the administrative realm, how much is it going to cost you? I think is something that you'd be very interested in, to figure out where can you best put your resources whenever you are trying to decide what is going to happen in your agency, organization, et cetera. And then finally, assessment can help us learn can help us understand what did we learn during the process. And that's helpful for caseworkers, also for social workers, or however you define your service providers, of how could they go back and maybe do something different? Or throughout the time in which you're providing the services, are there times when something needs to shift because you're finding that that particular service isn't exactly leading to the outcomes that you're wanting? So I want to briefly go over the types of assessments that are used here in the United States. The safety assessment is often the first assessment that happens after a call has been screened in, and there is an investigation. And so the safety assessment looks specifically at the immediate threat of harm and determines the need, if there's a need for an out-of-home placement. The risk assessment has been used to determine, is there a risk of future maltreatment? And what that includes, which I'll show in a minute, is it's problem focused. It looks at some historical and demographic information. And one of the issues is that historical and demographic information is likely, you can't change it. It's like, this is your past, this is who you are. And so we can't change those things. And so that led to the development of family needs assessment, which we'll talk specifically about the strengths and stressors, so that then we can have an individualized assessment that creates individualized or tailored services to be able to help the family. So here is the safety assessment. This is the one that's used in Ohio, where I'm based. I'm not going to go over all of the specific ones. These slides will be available to you afterwards. So what is risk? As I mentioned a minute ago, it's about predicting future occurrence of child maltreatment. There are risk models out there, and most recently, some of our colleagues have done work on predictive risk models, and how do we determine, or what are the best indicators of what might contribute to maltreatment in the future. Risk is also often a negative event happening. And as many of you all know, whenever you only talk about negative events or negative things within a family, or even with your own life, it's kind of deflating and it can be defeating. And so what you'll see with the strengths and stressors is that it is very strengths-based and takes into account the family's, what the family thinks they need or where their areas. So the research on risk, I've broken these down into, I've broken these down into the different domains, and you'll hear me talk about an ecological model, because the ecological model lets us look not only what is going on within the family, but also what are the societal, the agency, and even the policies that could guide how we view families and so forth, and what risks are become a problem. So for parents, maternal and drug alcohol use, mental health, the Center for Developing Child found that a mom's depression is related to her for her kids experiencing toxic stress. A mother's age, as we know, sometimes younger mothers or younger, and you'll see it's focused on mothers. It's not just about mothers. It's the family dynamics. However, mothers are the ones that are typically the ones who are the focus of services depending on the different demographics. External locus of control, parents' low self-esteem, and also if they're unemployed. For parenting, not understanding a child's developmental needs, that impacts the expectations that parents have on kids. And so sometimes a parent may have an expectation that their their infant toddler has higher order thinking skills, and that's not consistent with their development. And then also for inconsistent discipline, whenever the children can't predict what's going on and what may happen, then that always also leads to risky parenting and poor outcomes for kids. At the family, having prior reports of child maltreatment, the fewer number of adults increases the risk. The number of children, as you have more children, and then the interaction between number of adults and children, if you are outnumbered, then that also creates a risk as they're trying to manage a household with lots of different dynamics. Being socially isolated, not having housing or having affordable or consistent housing, and also domestic violence. Poverty, and I don't want to say that families in poverty are more likely to have child maltreatment, but for families who are in poverty, being able to manage the demands of not having their basic needs met, then that also contributes to the risk of child maltreatment. For the kids, what I want to say is that the kids don't cause the parents to maltreat them. Actually, it's just the dynamics of parenting children who are difficult to soothe, irritable, kind of think of at the baby stage with colic and if they've been medically fragile or needy, if they have behavioral problems, if they place excessive demands on the parents, and then the age of the children. Children who are younger are less able to protect themselves and also to disclose that they've been maltreated. And so that's one of the risks. So I wanted to move to protective capacities because I don't want to just talk about the negatives. So there are mitigating factors that reduce the exposure or the response to risk. And then I always want to promote that there's resiliency in the face of adversity. So some of the cognitive and behavioral protective factors are that they recognize that there's a threat of harm, that they are able to implement ways to manage those threats to harm. They can actually intervene. They have a history of protecting the child. They're able to defer their own needs to understand that the child's needs take precedence over their own needs. They're able to actually meet the child's needs and understand the developmental aspects of what that child needs at that point in time, that they have impulse control, and that they learn new ways and are open to learning new ways that they can then generalize to other areas of their life. We know that child protective services or even working with families in any system, that we can't do everything. We have to be able to prioritize what's going on, but whenever we teach skills in one area, those skills can often be generalized to other areas. So emotional protective factors is the ability to receive and give emotional support. The more we learn about attachment and the role of attachment in the daily life of the family and the family members and the kids, then has implications for how attachment occurs over the lifetime. And then conditional versus unconditional love is really being able to understand that we all make mistakes and that kids make mistakes, and being able to love them even throughout the hard times. So I mentioned the risk assessment. These are the items that are on the Ohio's risk assessment, and these were taken from the structured decision-making model. What I want to point out is that for these are just based on neglect, where there's a score that's generated at the end to identify the level of risk, which then is used to determine whether or not a family's case is open for services within the child protection system. I already mentioned the number of adults in the home and the number of children. Like I said, if you're outnumbered, then sometimes you have to play zone defense and aren't able to attend to the individual needs given all the dynamics. If the caregivers have problems with their parenting skills, and these are the exact words that are used in the model here in Ohio, or if they have mental health issues, then that can also, these all predict risk of future maltreatment. If the caregiver is involved in harmful relationships with anyone, if they have a substance abuse problem, if they're experiencing severe financial difficulty. And then the primary caregiver's motivation to improve parenting skills is actually an item that offsets some of the risk. And then if the caregiver responds positively to the investigation and understands and takes it seriously, the complaint, then that also helps to mitigate the risk. For physical abuse, actuarial items from the structured decision-making, if the current report is for physical or emotional abuse, again, similar to neglect, they have prior abuse reports, number of children in the home, the caregiver's history of being abused as a child. If the secondary caregiver has a substance abuse problem, domestic violence, major parenting skills problems, and all of these are operationalized within the manuals, or if the child in home has special needs. So what I want to point out again is that some of these are based on demographics or history. These can't be changed. And so what's happened is that there are sometimes a case is closed, even though it's still identified as high risk. So in risk and safety assessments, a few of the other issues are that there can be systematic and bureaucratic barriers. There can also, my colleague John Fluke and his colleagues talk about, oh my gosh, I just forgot, the decision-making ecology. And that looks at not only the family dynamics in case success or case outcomes, but also what are the structural elements that also contribute to case outcomes. Implementation and training, if the tools aren't implemented correctly or appropriately or have fidelity to the original training and the intent, then that means that they won't be used objectively and consistently across all families. The risk and safety are deficit, and they only take into account a few strengths, surveillance effect, and then how do you know when to close cases? If the risks are still high, then we don't necessarily know at what point we can close the case because we haven't necessarily taken into account needs. So the revolving door, I always mention this as if we don't provide services to address the family's needs and we look at the risk factors that we can't change, then it's likely that recurrence will occur. So a future child maltreatment will occur because the family's needs have still not been addressed. One of the areas where I think that there's a good way for the risk and the needs to come together is that we can look at what the risks are from the structured decision making. So for example, we have a mother under 27. So what might her needs be? So she may need social support. She may need education on what the child's developmental stages are. She also might need to understand how to manage the priorities in the house so that those who are most in need or most at risk, that they can actually put emphasis on what their needs and then also be able to delay our own priorities. For substance abuse, we know that substance abuse is often related to an undiagnosed or even a diagnosed mental health issue, that sometimes substance use is related to self-medicating, and that there may be a poor living environment. And so we can actually intervene at these levels, whereas if we just talk about the occurrence of substance abuse, it makes it kind of hard. So for a number of children, and these are just examples, there's a whole lot more, is again, the competing needs for each child and being able to meet all their needs. Also, what resources do they need? So are there kids with different emotional, social, and material needs? And then also child development. And then prior reports, this is kind of the revolving door. So are there unmet needs or unresolved issues that did not show up on the risk assessment, but we know that that's what's related to prior reports. So now I want to introduce the Strengths and Stressors instrument. This was created by Marianne Berry, as I mentioned earlier, and then it was revised with her input for Boys Town. So the features are that it's based on the North Carolina Family Assessment System. It's also short and easy to complete. I don't know if many of you all have done assessments with families. That here in Ohio, the assessment several years ago was that it was over 30 pages long. I imagine that many of you all have a lot of demands on your time besides just doing assessment and case documentation. And so one of the goals was to make sure that there was something that was short, easy to complete. It actually like worked for the caseworkers and the family, rather than made it something to where they felt like it was just a hoop that they had to jump through. It incorporates not only it doesn't look just at stressors, but also at the family strengths and how can they use the family strengths to support the reduction in their stressors. It was developed and validated with families involved in the child protection system. In one of the studies that we did, we were able to actually distinguish between physical abuse cases and neglect cases. So basically that meant that the instrument could had different items that related to physical abuse that were important, and then different items that related to neglect. It's completed with the family, and it's also being used to engage the family. And I can talk more about engagement and quick and early solutions from the Boys Town model. It's ecologically based, and as I mentioned a minute ago, that means that it takes into account the onion of families, because we know that families exist in an environment, and that for me, what I liked about that is that it doesn't just place all the attention on what's wrong with the family, but it takes into account other elements. And it also provides opportunities to include social support and other supports that are available within the family system. It can be logically linked to services, and for those of you who want to show to your funders, it can also show outcomes. So the domains, again, are ecologically based. So we have environment, and I'm going to go through these in a minute, social support, parental capabilities, family interactions, and family safety, and then child well-being. So who fills out the strengths and stressors? In some instances where I've used it, it's completed by the primary caseworker. If you are using it in a child maltreatment system, it's often after the investigation is done, and if the case is open for services, at that point, you would the ongoing worker, as they call it here in Ohio, they would be completing it with the family. And it can be done in partnership with the parent, because we want to empower the parents that they are the experts in their lives. And so we want to take into account what their needs are and what their thoughts about their own family. If they do have a different rating, then what they've done is in Boys Town is that they've circled the caseworker's rating, and then they use a different symbol for the family's rating. So when should it be filled out? So they recommend that it's filled out at least twice, and that can be dependent on the length of time that a case is open. For the Boys Town model, their cases were open for about 2 to 3 months. Some of them were longer. But if you fill it out at intake, and then when you think you're about to close the case, then that can help you determine whether or not it's time to close the case. You can complete it more to track changes. And also, if you are finding that an intervention isn't quite working and you have the family do, or you do have the strengths and stressors again with the family, then you can determine, are there other services that might need to come into play. You will get the tool and also the case example that we're going to do. So I'm just going to quickly go over what's included in the environment. So one of the really great things about the strengths and stressors is that it can be adapted to your location, your jurisdiction, and to your families. We recommend keeping the main categories. So under environment, it's housing stability, but all of these examples, those can be adapted to your particular situation or your needs. So you see safety and community and habitability of housing. So an example that I have is for habitability of housing is that in some environments that it's actually possible for a family to live in a tent. And I know that this occurs in Hawaii. I know we had there's tent cities in San Diego and other places where it's typically warmer. And so if the family has actual like space and privacy for the kids, but it may not be in a house, then we will go and assess where that family is. And is that environment safe or is it not? And then we can make adjustments. Take a moment for you to look through these. I'm going to have a drink of my Diet Coke. The next area is social support. We know that social support is critical in helping families, and the lack of social support leaves families and children at risk of experiencing negative outcomes. Parental capabilities. Again, all of these items are rooted in the literature about families in need. They're related to risk, but these are all things that can be changed. Family interaction. As you can see, expectations of children, again, that's related to risks that we know of parents not understanding child development. Family safety. As you see, there are no strengths on this one. That was done intentionally because we wanted to use the 0 as the norm. And then child well-being. I meant to mention, go back. The 0 is what's considered adequate or what the community norm is. And this is, again, where you can tailor it to what your population is that you're working with, the constraints within your system and within your environment. So I want to take a moment to do a case example. The case example is also provided to you in the materials. So for this family, it's a family of 4. The mom is Janine, she's 22 years old. The father is Robert. Robert dropped out of high school. He did work at a local grocery store. He recently lost his job. Connor's 11 years old and in the 4th grade. Andrew's 7. In the US, 11 in the 4th grade would mean that he has not passed or has been held back in a grade. So the other family information is that under income and assistance is that, as I mentioned, Robert lost his job. The family receives food stamps. They have government health insurance in the US, it's called Medicaid. And they also access and are willing to use a local food bank. For transportation, their car is unreliable or they don't have gas money. So they often have to use public transportation and they're willing to use public transportation. For their social network, as you'll see on the strengths and stressors when we complete it, that they do have extended family in the area. They're active in their local church and they have numerous friends, but a lot of their friends are people who they party with. However, they consider them to be supportive. So the family history on the parents is that Jane was physically abused. She's drank alcohol since she was 12. On average, she's drinking 4 to 5 drinks a day. And she also did so throughout her pregnancy and has continued to drink this amount, or sometimes more, and her consumption of alcohol has increased over the past 3 months. She's never been in treatment. Robert also drinks, and he was physically abused by his father. So Connor, he was born premature at 28 weeks and was in the neonatal intensive care unit. He was difficult to console. He's been diagnosed with attention deficit and hyperactivity disorder, and the way in which it manifests is he has poor impulse control and poor executive functioning, which impacts his ability to manage school and peer relationships, and also to manage the demands of going to school and completing your assignments and actually turning your assignments in. He struggles with his peer relationships and has one friend, but the friend goes to a different school. So he's pretty lonely and isolated. Andrew was born at 34 weeks and spent 2 weeks in the neonatal intensive care unit, and he's an average student and is at grade level. So the living situation, they live in San Diego. I put the average temperatures in Fahrenheit and in Celsius. I figure there are people throughout the world besides the US that actually have a reasonable metric model for temperature. 2 months ago, they were evicted from their rental home due to not paying their rent. They're currently living in a tent with 40 other families. Their tent is partially enclosed, and they recognize that they need to provide more stability to their tent and completely enclose it. They have 2 mattresses, and the boys share one of the mattresses and blankets. The family wants to obtain more stable housing. However, at the present time, they are just meeting their basic needs. Janine and Robert, they argue constantly, and they argue in front of the kids. A positive is they both say that they love each other and they don't like to argue. Unfortunately, Robert's very hard on Connor and treats him very differently than Andrew. For the child abuse report, Connor's teachers noticed that he had bruises and that it looked on his arm like someone had grabbed him, and that the bruise was consistent with like a handprint. Connor reported that he receives the majority of the physical discipline. And based on the information from the teacher and the principal, then they made a referral to children's services. Because of the level of bruising, then the case was investigated and was opened for services. At the time, the safety assessment was completed, and they didn't feel like the child, that Connor or Andrew, met the need for being placed outside of the home. And make sure I track my time. So for services, both of the parents want to improve the situation. However, they still both believe that physical punishment is an effective method of discipline. They're stressed due to their financial struggles, and they believe that the stress of not having enough money is affecting their ability to parent. So I went through and I completed the strengths and stressors on the Dean family. And we'll see in a few minutes how these strengths and stressors are used in the case planning and the provision of services. Since there are multiple items, I chose to just focus in the case example on housing. And so I'll talk about how housing was used to design the plan of intervention. So housing stability, because they lost their home and they're in a tent, it can considered a serious stressor. This is also based on Maslow's hierarchy of needs, that they need to have safety and access to basic needs. Safety in the community. Oop, I forgot to circle that one. I would probably say that that was at adequate or the community norm, given that there is a whole tent city, although it might be considered mild. The habitability of housing, they do have a space, and there's 2 mattresses. So I consider that to be moderate. Income and employment, they haven't had stable employment. They're struggling with budgeting and meeting all of their needs. Food nutrition, they have access to food. Personal hygiene, I couldn't put all the details into a case example to be able to present it within an hour and all the other information. Transportation, they do use public transportation and have a car. And then learning environment, it was at the community, or it was adequate, since the kids do go to school. The social support, these are where they have the most strengths. And we'll talk about how they use these strengths to be able to address some of the stressors. So parental capabilities, they do supervise their kids. Their disciplinary practices, especially since the case was opened in the child protection system, then that was considered to be serious. The supportive child development, they don't know what disciplinary practices are consistent with child development. And so that was considered to be a mild. They don't have few mental health problems, few physical health problems. However, the alcohol and drug use, while we couldn't show that there was a direct linkage or a direct contributor to the family stressors, I still felt like that was a moderate stressor. So the family interactions with bonding because of the physical abuse, that would impact a child's ability to bond with their parent, the expectations of the kids, mutual support because because they argue all the time, that would be an area where we'd want to focus. And also the marital relationship. They've been together. They say that they want to get along better. And so I still rated that as a -1, just because there is a lot of arguing that's going on. I'll let you look at this for just a second. The family safety because of the physical abuse is a -2. There were no other ones that were considered to be high risk or stressors. For child well-being, the child's mental health, because of Connor's struggles with ADHD and his social isolation, then that's why I rated it a -2. Child's behavior, school performance, because because Connor was held back and struggles in school, then that's a -1. Relationship with his caregivers because of the physical abuse, it was rated -2. Relationship with siblings, because of the fighting and that Connor is actually seen differently and treated more negatively than Andrew is, then that would impact the relationship with the siblings. Because Connor doesn't have any friends, I focus on him as the highest risk, as you can see here, the non-infant child being at highest risk. So most of these are related to Connor. And so since he's isolated, he doesn't have relationships. But then motivation, cooperation, the family does want to engage in services. So when I completed the strengths and stressors on them at intake, as you can see, environment is where they have the most stressors. And then because of the fabulous case planning and the casework that's provided or services, then look at the huge changes that they made. Again, this is a fake case. I just have a lot of hope and belief in the system. So service linkage. So this is where I want to take from the strengths and stressors and show how that can lead to linkages between the whole system so that needs are met and we're reducing that revolving door. So where do we go from here? In the service planning, as you saw with the strengths and stressors, is identified the stressors, which are the needs, and then it's also looking at the strengths. So how can the strengths help the families meet their goals? And as they identify their goals, if there's a lot of strengths in an area, you can then use those strengths to offset what are also the priorities for which areas are tackled or addressed with the family first. So the strengths then define what services are available, and then the strengths then lead to outcomes and short-term and long-term outcomes. So the Boys Town service model, which you have an excerpt from it in the materials, but also you will be getting, I think it's 230 pages of all of the services that were developed and the goals and the objectives. And all of these map onto the strengths and stressors. So they use the strengths and stressors. All of the services are based on an ecological model where you are providing concrete resources, and then you're also teaching. And then you're also providing support. We know that this ecological model helps families the most because it not only looks at what they need, and in Boys Town, they have what's called quick and early solutions, to where after they identified something on the assessment on the strengths and stressors, they're like, is there something that our organization can provide to then quickly meet a need? So if they have a bill that needs to be paid, maybe their power's off. If the organization has the resources, maybe they can pay that 1 month. And then what they're going to do is they're going to teach them how to budget and become more effective in their budgeting and so forth. And then support who's actually there in their system to be able to support their progress. So as you saw in the strengths and stressors, there's a whole lot of items. And so at Boys Town, they decided to group these items by category. So we're going to focus specifically on housing. And so the system is, okay, environment, and then that relates to family problem area, because those are both related to housing. Income and employment, those are related to income and finances. General health, those were grouped. And then I'll go down here. Transportation was not. And then learning environment, supported child development and expectation of children, they were grouped into being the family problem area of learning environment. So here's where I think it gets really fun. I was so fortunate to work with Boys Town to be able to design this system, and sat around and worked with caseworkers, and then went back to caseworkers and said, how does this thing work? What do you think about this? Because I believe that we're all experts, as I mentioned, even the families in our areas. And I know from my experience of doing evaluations over time and working with agencies, if I were to design something and not get caseworker or system approval and buy-in, then they weren't going to use it. So in creating these goals and objectives, I also know that when we're working with families and we're working in big systems, that we don't always have the bandwidth to come up with unique goals and come up with unique strategies and so forth. And so what we wanted to do was to provide caseworkers in the system with things that they could go and choose that were already pre-populated into into their computer system, so that it made it also where we moved away from a one-size-fits-all model to actually where they could go, wow, if a family needs housing, we're not providing them with parent training. They may need parent training, but we're also looking at those priority of needs. And so it really made it to where everything could be individualized, again, because this is logically linked to the strengths and stressors. So the goal areas, which we'll talk about in a minute with the case, but I just want to introduce these to you. So these are the goals that they have. And then the goal areas map specifically onto the objectives. And so this is related only to housing. But as I said in the big manual, you have access to all of them. So what we did is we went through, and remember the ecological model, we have resources, we have skills and supports. So if you watch infomercials, you also sometimes see, but wait, there's more. So then what we did is we went through and we just brainstormed of, okay, so if your objective is repair, replace, or locate needed appliances, then how can you actually do this with the family? What can the caseworker do so that they're not having to just keep this resource in their head, but that it does give them strategies, and all of these can be adapted to your local environment or the families that you work with. These are just suggestions. So purchasing items, this is where, again, the resources that you're giving it to them or you're helping them get it. But then you want to also teach them. We know that families can't stay in our systems forever. That teaching them how to do this will be helpful whenever their case is closed. In the Boys Town model, they have a lot of teaching. They have a whole model called Teaching Family Model. I do encourage you to check out Boys Town. this is specifically from their in-home family services program. And then housing support services. These are where you're connecting them or helping them learn how to connect with other housing services that may be in the area. It also identifies family and friends, because we know that there are formal support systems with services, but there are also informal support systems. And as long as those supports are positive, because we know that there's a difference between what we think might be supportive or who we think might be able to support us. So that's our perception of supports, but it's also identifying who's receiving those services or who will actually provide that support for them. You can see here the social network map. I'm happy to share that as well, but that went beyond what I could talk about in this amount of time. So the Dean family, if you remember from up above, and I'm only focusing on housing, there was a whole lot going on. So when I completed the family problem area, so it took the 2 items of housing stability and habitability of housing, and I added those together, and it was a -5. Now, the strengths that relate to this family is that they have social relationships. As you saw, they have family and friends. They are in a city where there's regular services available. There's emergency services, and that they are motivated to take advantage of these services. So when I went through, and I work with systems and with caseworkers, so I'm not a clinician, just want to put that out there. But from all the years that I've been teaching in my practice, whenever I was doing it, these are what I thought would be the goals and then the objectives and strategies. So we want to make sure that the resource goal was that they have a child-safe home and that they have the materials and supplies to have a child-safe home. So when I look back, I recognize that they didn't have enough tarps to be able to fully enclose their space. So the resource was that we provide them with additional tarps. We find beds and bedding. So the skill was, let's also help them identify other areas and make a plan, because we can't do everything for everyone all the time. And then the support was to access housing resources. One of the skills would also be related to, let's teach them how to fill out the applications, because I can say in a general sense, oh, you guys need to go and get housing. Okay, but we also need to break that down. And that's one of the things that the system does as well, is it helps break it down. So case closure, because of our awesome services, the intake score was -5. And if you move down here, it was +1. What they did is that they worked with the caseworker to implement the strategies. They ended up getting additional tarps and bedding. They also started accessing housing resources. And then they used local housing resources. They got on a waiting list for low-income housing. And so they were able to actually start moving forward. So I want to briefly touch on the evidence base of the Boys Town model. All of the strategies and the objectives and goals, those were related to what we know about working with families and child protection systems. So when we did the initial study of the model, the average number of family problem areas selected per family were 2.37. For that model, supervision and discipline were the most the problem areas most often chosen, then domestic violence and income and finances. I want to point out that this was done before COVID, and so it may have changed since then. So as I had mentioned before, Boys Town is very focused on teaching. And so you'll see for each of these family problem areas that they were doing a lot of skills in teaching. And I'll talk about in a minute that these data were actually used to help the caseworkers, to help the supervisors in the system go back to the caseworkers and say, we might need to do some retraining, because we want to make sure that we're also providing resources and support and connecting with support systems. And so they did, and these numbers actually changed as they explored the implementation and used the performance dashboard. So the data showed from pre and post on these three areas that at intake, there was change and it was significant, pretty significant within effect size. Income and finance, and then domestic violence, they were able to adjust that. So talk briefly about here we'll go back. Balanced scorecards and performance dashboards for the administrators and the supervisors. What the balanced scorecard and performance dashboard can do is that these were done quarterly. And so sometimes when we do evaluations, we make it to where we assess something at the end of a program, at the beginning and the end. And so because the system was set up to where the caseworker would do the assessments at intake and closing, and it was kind of within a 3 to 4 month time period, they were able to look back within 3 months and go back and look every quarter and not have to wait for a year to find out what the results were. So they were able to start implementing changes, adding new trainings, providing other supports as they found out that those were needed. So these data are older. So for goal attainment, they were able to show improvement and that goals were being reached. These are across the entire system. For this, Boys Town does a lot of implementation monitoring. And so this slide shows for, as I mentioned, the QES is the quick and early solutions. This is the social network map, the strengths and stressors, the family problem area, and progress. So they went in and they did a review with their management system, their electronic management system. It's kind of like an electronic health record. And they were able to identify documentation of, did the caseworker actually do these different assessments? So you can see at the beginning when this system was first implemented that they were trying to get they were really trying to find benchmarks of where they're starting and then see where they go and then where there might need to be training points. So from January to March, there was a decrease or it was an increase and then a slight decrease. And then they started documented the family problem areas. For the strengths and stressors, here's green. At first they were doing okay, and then it dropped off. Seemed like everything dropped off a little bit that month. And then they started documenting intake and closure of the strengths and stressors. So as I mentioned, as administrators and even as the caseworkers, you can use this for supervision to be like, hey, what's going on? What do we need to do? Are there things that we need to tweak in our system? So again, they use benchmarks. This is where they identified for their organization where they were. And then they could use that to retool their system as needed. So the Boys Town, here's the whole model. So we have this, it identifies the support systems, and the support system is within the family, but also it's within the community. What they did is they identified other agencies that would be able to help them meet the needs for the objectives and the goals and the actual strategies. And so they used the strengths and stressors to say, these are the stressors that our families are identifying the most. What other community agencies can we work with? Who do we need to contact? What other things do we need to put within our system? So here's the process: is there would be a referral. Lost my mouse. There'd be a referral, and then they would engage, and that was at Quick and Early Solutions as they completed the assessment. The assessment was boiled down into family problem areas, and then that's how they created the goals and objectives. And then there were the resource skills and supports, and then the goal progress, and then their outcomes. So I mentioned with the dashboards, they were able to be used for training. They were able to be used in supervision. And then they monitored implementation, and then information technology. That's where they created an online system that could be used. And then the administrators could determine what needs were available and where they were going to put in some of their resources. There are also cost recovery and turnover data, but that went beyond what I was going to talk about today. So what do we do now? So we have, if you're in a child protection system, we have safety and risk. But what I want to really push in this is that we then start looking at strengths and needs. And as I mentioned earlier, we're able to prioritize what the needs are because we will see on the strengths and stressors how the family is scoring. And so you take the strengths and stressors, now I'm using my hands, you take the strengths and stressors and you identify from like Maslow's hierarchy, what do we have to do right now? We then use the strengths and stressors to drive what services and create those logical linkages. We have initial data from whenever we were doing the evaluation of the model. And so we were able to see what was going on where the system needed to be retooled. And so that's where I say evaluate, evaluate, evaluate. Because while we have data on the model from Boys Town, you will want to also do your own evaluations because we are all committed to making sure that we provide the best services in the best possible way and being able to use our evidence to do that. And then create feedback cycles. So that's the end. At this point, I'm willing to take questions, comments, and I'll let Jane or Holly take that over.
Patty, thank you so much. You might want to take a big drink of that Diet Coke because we have lots of great questions and comments for you. First of all, I just sincerely thank you. You did a great job presenting a very meaty tool and a complimentary manual. And so there's a lot of great comments that I want to share with you. In regards to Q&A, I want to do justice to what's specifically being asked. So for anyone that I'm trying to ask your question and I'm not hitting the point that you're trying to get an answer to, please just pop that back in Q&A or chat, and I'll make sure that we clarify with Scotty. If you're ready, Scotty, one of the kind of combo of a few comments that were made, and actually some of the questions were just about this potential subjective nature of the assessment, of the person completing it, uh, is it part of the manual that we didn't go into great length that kind of has guidelines to
Yes.
scoring? Okay, so that's in that meat of that Boys Town manual.
Yes, it is. Yes,
Okay.
the 230-page one. Yes. Yeah,
Okay.
it's in there. And it has very specific indicators for each of the areas. And so it's very thorough. And in their family problem areas, there's a family problem area for each item that's in there.
Okay.
When you talk about subjective, one of the things that there's a balance of is, okay, I have a validated measure, but if I start changing the what was in the parentheses for the strengths and stressors, is that going to invalidate the model? I mean, or the instrument? Sort of, but I also think that if you do your own evaluation on how it's working, on how the manuals work, I mean, the strengths and stressors and the services, then you can start to validate it within your own setting. And we wanted to make sure that it was adaptable to different cultures. And so I think it's more important to make it adaptable to your population than it is to be so dogmatic in making sure that we stay at using the strengths and stressors as it was designed for the US, if that makes sense.
It makes perfect sense. And that is actually one of the key points, the diversity of our audience today. So would you suggest if someone in a different region of the world would then change the guidelines? So the tool itself could be used in its current format, but those guidelines of what a score, what ends up being a strength or a stressor, or just that sliding scale score, that would be based on cultural things, geographic regions, living situations.
Absolutely. Yeah, that's where, because you also, if you use this instrument with families that are not in the US, for example, if you're asking those questions and you're using just the US model, that's not going to really engage the families. They're going to be like, this has no application to me. And so, like I said, I think you can get around the not having the validated US model by evaluating the strengths and stressors in your own system. And I'd be happy to talk with people about that afterwards.
Thank you. That is a really key point, I think, of this. So thank you so much.
Mhm.
A couple other questions that came along that same line is exactly what you said. What adjustments can we make to make this culturally relevant to other populations? I think that's the point you're making. Any other comment you want to add on that?
I mean, I think it's also talking, if you are starting to, if you want to like change some of the what's in the parentheses or even add additional items, is that you also have to get buy-in from the people who are providing the services. And so doing focus groups, asking them to provide information, I think would help with also the buy-in. Or even asking families after you're using it for a little, like, hey, is this hitting the point? Am I missing something here? What else do we need? What else do you all need? And then going back to evaluate, see how it works.
Perfect. Thank you. And there was a question along that line as well, is like the different stakeholders, like who would be involved in this in your mind, and how do you engage different stakeholders in this process?
That's kind of a hard question to ask, but the different stakeholders in my mind are the families. So if a family completes services, asking them, how did this work for you? Also the caseworkers. Every time whenever I would go to Boys Town is in Omaha, Nebraska, I'd sit down with the caseworkers and say, are we on point here? What else are we missing? And then sometimes we gave the whole system to them with all the service planning materials. And they said, well, this is not actually logistically possible for us to do X, Y, and Z. Maybe housing, like we don't have a lot of housing. We're in a rural area. We don't have a lot of housing opportunities. What else can we provide that is specific to this context? The other stakeholders are like within supervision. If you're finding, if a supervisor is working with the system or working with a caseworker and they're finding that there's not a lot of progress, then being able to talk with them during your supervision meetings and say, what else can we do? Is there something that the agency can do to support you? Or are there other trainings that you might need? And then working with them. And really it's building relationship with between the supervisor and the caseworker. And then at the administrative level, you're going to be able to see how's your whole program doing? What are you all finding are the biggest needs in your area? Are there areas like Boys Town? What they do is they have the whole model fidelity and implementation. They use implementation science. And so they will send out people to observe the caseworker in when they're working with the family and identify where there may be gaps in how the caseworker is working with that family. And then they report those and they benchmark those. And so then also how I always see it too is that you can roll up the data. So you can start at the data at the family level and then look at the caseworker level and then look at the program level. Whenever we're trying to compete for funding, one of the categories that's emerged is whether or not you can show that their families are actually changing or the individuals are changing depending on what your system is. And so you can use data to be able to put into grant applications or to be able to go to a funder and say, hey, we're finding that we really need more housing supports, like I said, in a rural area, semi-rural area. And then work with these other agencies to say, how can we find more housing resources in our area? Because this is what the data are showing. Or these are the areas on the family problem areas where I'm not being able to make as much change as what I want. Or, hey, we're finding that this family, that they really are bonded with or participating in their church. And so how can we maybe work with the church? Let's say it's about food needs. Are there ways in which their church or spiritual organization that they can start looking at providing foods or food networks or food banks, et cetera?
Oh, that's perfect. And that was one of the questions as well. So you showed a great slide about implementing intervention strategies and the really tremendous impact that that slide showed in those three areas.
Mhm.
Does the manual then contain specific ways to impact, whether it's to minimize a stressor or to maximize a strength? Is this in the Boys Town manual as well that kind of gives some how-tos?
It does have some how-tos, and if it doesn't have how-tos, I'm willing to talk through about what we saw in practice. And if I need to provide a supplement, then please let me know, and I'm happy to do that.
Oh, thank you, Scotty. That's very generous. Okay, so now a few questions on the actual case study. And I believe this came out of it. So one is a question about this: is physical abuse also the cause of emotional abuse? Is not the cause. So it's actually, let me go back. It said, why would emotional abuse be a 0 when one child is physically abused and treated more harshly than another sibling? Is not physical abuse also the cause of emotional abuse? Do you want to comment on that?
Yeah, so measuring emotional abuse is hard. We struggle with that in the US in our child protection systems. And so because this was brief, then I was trying to just focus on the big things. And because I'm not a caseworker, so maybe it should have been. And that's where, again, I rely on the people who actually are on the ground doing this stuff. And so I appreciate the comment. And so, yes, probably emotional abuse should have been a stressor.
Thank you. I think we've answered this, but I'm going to ask it again just to make sure that, because I think it came up a couple times. It says, is there a criteria for assigning a score on the assessment to ensure all workers using the tool are assigning families with a similar scoring? Again, I think it's a point that we hit on, but it's worth repeating.
Yeah, I think that's where you would, in supervision, I think that's where you would be asking those questions. And then if you do have the resources to do fidelity monitoring, where you're sending out people whenever the caseworker is doing the assessment, I think that's where you'll be able to also see, are they being consistent? Are they catching all of it? I think also what we found is if you're finding that there's not a lot of variability in how the scores are, like everyone's getting a 1, then I think that's also another place where if you're looking, that's where that performance dashboard comes in. If we're looking at 3-month or, going back a quarter, I mean, then you can also aggregate it to 6 months, a year, et cetera. But that's where you can start making those changes rather than waiting for a year to go by before you start addressing, like, hey, what's going on here? We're not really using this model as it was intended. And so let's figure out, do we need more training in this area? Are the items, back to the cultural specificity, are we missing something here? Are these items or these characteristics, are we not capturing what's actually going on in our families?
That's very, I love the Boys Town quarterly assessment. I thought that was very impactful to like get out in front of issues. And um, so then there's a question about the child well-being part of the tool. And I think
Okay.
this came from the case study specifically, but it may be a more general question. For the child well-being part of the tool, is the assessment per child or is it generalized or average? Because in this case, you had the 2 boys who had different experiences in the same family.
Yeah, so what we did is we identified it, or we used the child that was most at risk. However, if you're finding that there are similarities, like let's say the children are treated the same and both were being physically abused, then you could do that for both of them. I don't want to make it really prescriptive. And so if someone were to go, oh, wait, I want to do an average over the whole family, then do that, because it has to work for the people who are using it, rather than me, sitting in my office at Ohio State and, dreaming stuff up. And so I think but make sure that that's a decision that is made at the organizational level. So then you don't have people kind of going rogue, and then that would mess up your data. It's like, who are we going to use this on? How are we going to define how we do the child well-being, so that we make sure that we're consistent across different caseworkers?
Perfect. Thank you. There's a question about explaining the questions for physical, sexual, emotional safety not being tested with strengths on the assessment.
Yeah, so yeah, that was a really hard one, because we were like, okay, is the absence of physical abuse a strength? It's like the caseworkers are the one that gave us the feedback on that. And they said it just doesn't make sense to put in strengths there. And so that's where we put that it was adequate or the community norm. So the community norm is that there's not physical abuse, there's not emotional abuse, there's not sexual abuse. And so that was caseworker informed.
Okay, that makes sense. And how you explained it now. And then Kelly Jones asked the question, Kelly, just in case there's more clarification that you want to put in Q&A if I asked this incorrectly, but it sounds like you validated the strengths and stressor in you put OZ population. I don't know, Scott, what where that would be. So there were very different loadings of questions on domains, cultural and policy environment, important consideration using the tool. So I think this speaks to the adaptation of the tool and really.
Yeah, so it was initially validated on a sample in Texas. And so when we did that sample, or when we did that evaluation, we were able to distinguish between physical abuse and neglect in families, which makes sense because neglect is often associated with medical, with not being able to provide needs, not even basic needs, and then physical abuse can, whatever. I don't have the specific risk factors for physical abuse besides what's on the structured decision making. So then we didn't revalidate it with the strengths and stressors, the next version that was at Boys Town, but it can be. And that's where I encourage organizations to go ahead and validate it within their own systems.
Perfect,
And
thank
all
you.
of and so I provided with you all of the different resources and articles that have been written around this area, and the validation study on the strengths and stressors is included in that, in those resources. And I think you said, Jane, that you were uploading those to the uploaded those to the actual site.
Yes, in fact, they're already on the page.
Oh, perfect.
I just and I will also add your presentation slides and the recording. So if everyone wants to give it a few hours before they access the webinar page on the website, it will be comprehensive by the end of the day. But yes, that will all be on there. All the research that you shared. There's just such, you really gave us a depth of information about this model and about the thoughts behind its creation and adaptability. So thank you for that.
Oh, you're welcome. It's one of my passions, and I love working with agencies and organizations because you guys are doing the change. And so it's exciting for me.
Well, you can tell it's your passion. So thank you. So there's a question at the beginning of the presentation. You reviewed the Ohio's model, which I know you're very familiar with. Kind of comparing that to the Boys Town model, like is the Ohio model more subjective? Is it the lack of focus on strengths? Like what is the real difference between those two things?
So the Ohio model, when I evaluated it, it was focused on, it is the child protection. So I guess this would be a good distinction. So that is the child protection system. So it had the safety assessment and the risk assessment. And at that time, the structured decision-making didn't have aspects of needs. And so that evaluation finished. And then I started working with Boys Town. And so Boys Town, the way in which they received their case referrals is that the case had been opened by the child protection system, and then the Boys Town was the service provider. And so they would get all the information from the intake from CPS, and then they would then use that information to understand what was going on with the case. And then when they went out to meet with the family, they completed the strengths and stressors. One of the reasons that distinction was helpful is that we know that at the intake process, it's pretty stressful, and that isn't always a time when a family will engage with you. And so they then use the strengths and stressors as, let's partner in this next part of the process whenever the services are being provided. One of the really nice things that Boys Town allowed me to do was also to go on home visits. And so I was able to, with the caseworker, and so I was actually able to see the way in which the assessment was completed, and then the way in which services were provided. And again, Boys Town does lots of stuff on fidelity. They were very consistent with what the model was, and I was able to see that in person.
That reminds me of a comment that you made to me in this planning process about the trust level of the parents when the assessment tool also focuses on strength. that there seems to be a broader trust level of parents engaging
Uh-huh.
and making change when there's also a focus on their strengths, not just what's wrong.
Right. And that was one of the things when the whole assessment was developed, was to really move it away from this deficit model and treating one of the hallmarks of family preservation, is what I did my work on at the very beginning, was that our clients are our colleagues, and that also that we don't know if something doesn't, if there's not hope. And so if we take that, and also that the families are the expert of their lives, and we use that as our guiding framework for how we work with families, then that is what was tried to be infused into the strengths and stressors, and also into all of the services and goals and objectives. That's going to go a long way for creating a partnership. And so with Boys Town being or you can even do this with ongoing services, because it's not that investigation kind of focus, then this is really about, let's find out what your needs are. Let's figure out how we can help you. But you also, for the families, you guys bring a lot of strengths. You may not feel like there's a strength, but I think, even exploring with the family, like, hey, what's going well? Or what worked well in the past? And using a bunch of different modalities. It doesn't just have to be what's at for the Boys Town. I mean, that's the structure of the system, but the way in which your caseworkers or the people who work with the families, the way in which they engage the families, keep having them do that. Let them use all their skills. The manual is just to really provide them with ideas so that they aren't just providing the same old, and kind of take some of the burden off of them, because they are in exhausting, overwhelming situations a lot of the times. And so it's like, hey, here's a menu. Use the menu. If you find, and even in Boys Town, it's like, if you find that there's something that's not addressed in there, then let's add it. And then we'll start to look at, let's add that to the manual, because maybe there are other people that are struggling with trying to come up with something in the menu doesn't have everything that they need. And so then you look to see, let's see how that goes.
I think that's the true strength of this tool, is that it's a breathing document.
Uh-huh.
It's constantly adapting and changing. And I think it also comes from the premise of nobody wants to be a bad parent. No one
Right.
wants their children to have a negative experience. No one wants to have all these stressors in their life. It's no one's goal. And it feels like this tool and its constant adaptation really, solidify that, right? It's the basis of why it was created. And
Absolutely. And, I mentioned earlier, I mean, you bring up a good point. I mentioned earlier that sometimes these assessment instruments are focused on moms. There's a great book called Manufacturing Bad Moms or Bad Mothers that came out in the 90s. And in that, it really pointed out that we focus a lot on moms, but it doesn't mean that they're the problem. It means sometimes it's looking at how they are within a system, single moms, et cetera. It's like, oh, we don't want to excuse dads. But we want to take into account who's often the primary caregiver, but you don't want to go at it as there's something wrong with you, that you are a failure, because I believe that everyone is doing the best they can within the situations that they can. And we all don't have the luxury of understanding what child development is. Even me as a professor in this world, when I have my own kids, I was like, oh, I think I told you, Jane, yesterday, my case example changed from when I did it before I had kids, because there are so many different complexities and families are so different, that really being able to look at, what are you guys doing well, and supporting that, and using what they're doing well to support their goal attainment. And so I think that that is empowering.
thank you. Your points are so well taken. There was a question about the tool assessing willful neglect.
Ooh, I, that goes beyond my, I'm one of those people who will say, I don't know.
Mm.
And I don't know how. I think that goes back to the risk and the manifestation. It's like, how, if it's willful neglect, what are the underlying things that are going on in that family that would, or within those parents, that make it willful? And so really pulling it out from, okay, this happened, we believe that it is willful neglect, but why is it willful neglect? And where are the intervention points that we can go in and help build up capacities, build up knowledge, build up engagement to be able to then address what that might be or what's causing it.
Thank you. Next question. Are children always interviewed at the investigation or afterwards regarding their goals about the family's goals? And if so, from which age? And so I guess, is the voice of the child in this assessment at all?
No, it isn't designed that way just because of this isn't an investigation. And so I think if you have kids that are older, you might possibly be able to get their voice in, but that would be something that would be agency and jurisdiction related. But I have not seen it used with asking the kids. I think that you could get an overall assessment of what's going on, and then that's where the caseworker, agency, whatever, could be able to determine, is there a way to include the voice of the child?
Perfect. Oh, for Kelly, going back to her question about where she used the tool, it was in Australia. Thank you, Kelly. And then we've hit a lot of these about the adaptability for other population groups. And it actually even just beyond children and family, but just for other vulnerable populations.
Mhm.
Is there a way to use the tool?
I would defer to people if they see that there is a way to use a tool. I presented it to one of our settlement houses, as what they called it here. And I said, you may not take all the domains, you may just use parts of them and then see how that works. And so I do think it can be used across different systems and with different populations, but it would
What
need
about,
to be tested.
oh, sorry, I interrupted you. My
That's okay.
apologies. What about children out of home settings, whether it's, migrant children, refugee children, children with disabilities who may be, or kids in institutions? Like, how do you assess that without parents involved? Can the tool be used in those scenarios? And then who are you assessing?
So could it be used? Maybe. Again, I don't know. I would have to defer to the people that are out there. There is another assessment and case planning system that we did for foster families. And so maybe that would be another talk at a later point in time that looks at kids that are placed in foster care and then what their needs may be that are issues that foster kids have faced and what foster families and then the reunification process. So yes, there's something out there. As far as migrant families go, I don't know. That goes outside my expertise.
And then there was a question about the use of technology. So is this, I guess, a very basic question, is this a paper assessment? Is this an online assessment? I know what we're giving them, is kind of a PDF version. Was it done with the use of technology when you implemented it?
Yes, they actually had built a whole case management system. And so I think that makes it, I think it's resource dependent. I mean, if you're able to do that, then that's great. But if you are in an area where you don't, or your agency organization doesn't have that capacity, you can absolutely do it with paper. I would recommend using something like Excel to put the data into so that you can do assessments and you can then use that in supervision at the agency level. But for Boys Town, yeah, they did create a case management system.
And is that proprietary to Boys Town?
I assume that they're still using this and I can always reach out to them and see what they have, but yeah, it was proprietary to them. But again, you can use Excel if you needed to. If you have someone that's an Excel whiz to be able to manipulate all of it at the different levels. But all of the performance dashboards, those were all done in Excel.
Actually, that's a good tip. It really could be then adapted and tracked via Excel.
Yeah.
And then there was a question about some other work being done in the States, how if you're aware of it, and if it could be a nice complement to what you do. And the work that Sherry Hamby is doing related to resiliency portfolios. I'm not sure if you're aware of that. I think
No, I'm not aware of that.
Okay.
But yeah, I think with the fact that it does focus on strengths, that might be a nice, like, hey, does this work? And again, I really want to defer to the experts that are doing the work. And if you think it's helpful, it's great. And that was one of the reasons I wanted to do the webinar. And I was thankful that you all agreed with the method of my madness, is to be able to get this out there, because it's lived in, PDFs for several years. And so I was like, please, like, as I've seen and talked with people throughout the world about what their needs are, I'm like, please just take this, please use it, figure out how it works for you. And I'll go back to evaluate.
Yes, and thank you. Scotty very much is passionate about the same goal that we have at ISPACAN, is to get as many open access resources into areas that are needing the information, so there's not a duplication of efforts to create things. It's much easier to adapt a current tool that is evidence-based and validated for a particular region of the world than to start from fresh. And so again, thank you for sharing that passion with us, Scotty.
Yeah, thank you.
And there was a comment which I just wanted to make as well. It was just a really positive comment about, also that what do we do now slide. I think that is so very much appreciated. Like, okay, now that we've given you all this, what do we do now with the information? So again, there was just a real appreciation
Yeah.
for that. Okay, I feel like I have answered all the questions in Q&A, or at least tried to combine a few that were of a similar theme. Scott, I guess I'm really curious with you, like really key takeaways, anything, that you've covered so much in such an in-depth way, but is there any really key takeaways that you want to share with us?
I guess a key takeaway is more of a gratitude to you all that you asked me to do this, and also gratitude to the people who are doing the work, and that you guys are making the world go around and are making a difference. And so the key takeaways are, hopefully you find this helpful and that you can make it adapt into your current situation, and that we will continue to build up families and help them in the ways that they need, and to ultimately reduce or stop that revolving door, because the families are getting their needs met.
Thank you, Scotty. Very well said. I know that we are at time. I do have a couple closing slides, but we understand it's been a very full 90 minutes. So we understand if you need to drop offline. If not, feel free to stay with us for a few moments. We're just going to share a couple upcoming things at ISPACAN that may be of interest to you. But a sincere thank you to you, Scotty. And we really encourage everyone that we do have a poll at the end of when you disconnect from Zoom. And I just really want you to know that we do, in fact, listen and make changes to our webinars based on the results of that poll. There's the opportunity to give Scotty specific feedback, and then obviously feedback to us as a host organization. So it just should take you less than a minute or so to complete. So again, if you could do that when you disconnect, it would be very appreciated. Obviously, our most sincere thank you to Scotty for your expertise, for your time, for your passion, for all of that. And again, please just know that it's a very heartfelt thank you. And a reminder to what you're going to receive today, because I know there's been a lot of questions in chat about that. You will receive Scotty's presentation slides in their entirety. All the resources that she cited in her slides, she has shared with us, and they will be on that webinar recap page. You'll get a full recording from today's webinar. You'll get a certificate of attendance, and all this will be sent to you with links in a follow-up email this afternoon. So please keep an eye out for that. And just a few things that may, again, be of interest to our audience. We are so proud to announce a new practice-based open access journal that has been created by ISPACAN. We're trying to bring this whole data to action with really practical applications of programs, reports, innovative ideas to attack, very cutting edge topics in the area of child protection. So our first issue was last month, so feel free to access that. You can get it from our website, but we're also really looking for authors to contribute. This is a journal that really organizations have the ability to put their cutting edge programs in, and it's all completely open access to the recipient. And we have also waived the submission fees for authors through December of this year, 2024. Our guest editors for this new journal have made themselves accessible to you if you have any questions. We also did a webinar on how to publish in this new practice-based journal that is in our Knowledge Hub. If you want to go through that recording and the supplement resources, it can really help guide your submission. But we encourage you to do it while the submission fees are waived for all authors. We also, Scotty will be joining us if you want to meet her in person. We have our Congress in Uppsala, Sweden. Our early bird registration is still open through July 1st, with the Congress team really working together in times of crisis. So we're bringing together the brightest minds in child protection across disciplines, across sectors. So we're really just really trying to push the envelope on what we share with you to come together as child protection professionals and frontline workers. So if you can join us in Uppsala, Sweden, that is also on our website. And again, early bird registration is open only till July 1st. And if you're not a member of ISPCAN, we really strive to bring you these webinars free of charge. But there are so many member benefits to joining us for as low as $35 a month. You can see some of the great member benefits. I will also send some in the follow-up email. But we'd love to have you really be a more intimate part of our network. So consider joining us if you're not an ISPCAN member already. The benefits definitely outweigh the $35 cost. So again, Scotty, thank you so much. Thank you to everyone who joined us. I know for some of you it's very early or it's very late at night, and we appreciate you staying online and seeing this presentation through. And we look forward. Scotty has made herself available if you have any questions regarding the tool. She's willing to share her contact information. And I hope you found this very useful.
Thank you very much.
Thank you. So good morning, good night to everyone who joined, and have a wonderful day. Thank you so much. And thanks for engaging in the chat with us. We've really enjoyed it.
Bye.
Bye, Scotty. Thank you.